Hi, welcome to the healthcare training section. My name's Roxy Albin. I'm a registered nurse with Fostering Healthy Children, and I will be reviewing the healthcare training. Fostering Healthy Children program is a partnership between the Division of Child and Family Services and the Utah Department of Health. Fostering Healthy Children nurses' responsibilities are as follows. First of all, it's important for you to be aware that anytime a child comes into Utah State custody, they are not only just assigned a permanency caseworker, but they are also assigned a registered nurse. So each child has a registered nurse assigned to their case. Our jobs as the registered nurses is to assure that we evaluate and document a good comprehensive health history on each foster child and determine their health care needs. We are available to both foster parents and biological parents. We collaborate in training foster parents, new caseworkers, and providers out in the community. We coordinate with foster placements to assure that all follow-up health care needs are taken care of. We also enter all healthcare information into our SAFE database. It's extremely important for you as foster parents to be aware of the following. Children in foster care have higher rates of chronic medical illnesses, developmental delays. These delays may be in speech, physical growth, etc., educational disabilities, behavioral disorders, and mental health problems. Now, why do we have all these issues in our foster children? This is why. Small for gestational age, 20%. That means our foster children in their first year of age, more than 20% of them are small for gestational age. 40% are premature. That means they're born way before their time. 40% are born with birth complications, and 90% of them have a history of maternal drug use. This means that 90% of their mothers used drugs while they were pregnant with the child. Now, when a child comes into state custody, the state of Utah requires the following. Within the first 24 hours, they require an emergency visit only as indicated. If this is the case, more than likely the child will not be at your home, in your home at this time. But within 30 days of the child being removed from their home, the state requires the following: a well child check, mental health assessment for children that are 5 years of age or older, ages and stages questionnaire for children that are 4 months to 5 years of age, and dental examination. Now, please keep in mind, the state requires these examinations 30 days from the date the child was removed from their home, not 30 days from the date the child was placed in your home. So if for some reason the child has been in state custody for a week or 2 weeks, they stayed with grandma, they stayed with an aunt or uncle, and now for a week or two, and now they are in your home, the time for this 30-day time span has already started from the day the child was removed from their home. So therefore, at this point, it is extremely important that if they come to your home and they have not received their well child checks, their dental exams, their mental health assessments, that you work closely with the Fostering Healthy Children nurse and the caseworker to try and set and schedule these appointments as soon as possible. Annually, the state requires a well child check, a mental health assessment for children 5 years of age or older, and ages and stages are required for those children 4 months to 5 years of age. A dental examination is required annually, but is strongly recommended every 6 months. What does a well-child check entail? Well, it's a comprehensive examination where the provider will do a comprehensive health and developmental history. They'll do a good physical exam. They'll make sure that they are current and up to date on the child's immunizations and do any lab work as necessary. Anytime you take a child in for any medical, dental, or mental health appointment, whether it's a scheduled visit, an urgent care, a sick visit, shots at the health department, whatever the reason may be, the state of Utah requires documentation for every single visit. We, the nurses, will provide you with these health visit report forms. When a child is first placed in your home, you should receive a packet from the nurse assigned to that child, which will include her business card and contact information, self-addressed postage-paid envelopes for you to return these health visit report forms, and we'll send you a packet of health visit report forms. These are triplicate forms. We ask that whenever you take the child in for any medical, dental, or mental health visit, that you complete the top portion, which includes the child's name, the date of birth, the date of the visit, and if you could please also put down the provider's name or the clinic. Have the provider complete the rest of the form while they are tending to the child during the visit. Please make sure that you do not leave that visit without the form. Once you return home, we ask that you set that form, the health visit report form, tear the top portion, which is the actual original where the provider wrote, put that in the self-addressed postage-paid envelope that we provide for you, and send them to us. And we ask that you keep the carbon copies in the out-of-home binder or book that you will be provided by the caseworker. Dental exams. What do we expect in a dental exam? We expect a complete and comprehensive oral examination, cleaning, x-rays, and education. Mental health assessment for children that are ages 5 years and older. This is completed by a mental health provider, and the caseworker will work closely with you to schedule this mental health assessment. In this assessment, they will do a complete history, health and substance abuse history, as well as any abuse history, and then they will provide us with any appropriate diagnosis for the child and any treatment recommendations. These treatment recommendations may include individual therapy, family therapy, group therapy, etc., and at some times no therapy needed. Ages and stages. The Ages and Stages is a screening tool that we utilize for children that are 4 months to 5 years of age. You will be mailed these questionnaires at different time intervals with a self-addressed postage-paid envelope so that you may complete it as soon as you receive it and return it in the envelope provided. We use this screening tool to assess the child's developmental, social, and emotional levels. If at any point the child scores low in these, then we contact you and the social worker and do a referral for this child so that the child may be able to start an early intervention program, a Head Start, or special education. And through these early intervention programs, the child can be evaluated for any needs, whether it's speech therapy, occupational therapy, physical therapy, or any educational needs. Medication management. Medication management. Not every child that is in foster care is under a psychotropic medication. A psychotropic medication is a medication that is used to help with behavioral issues. Decisions to put on a child on a psychotropic medication are made as a team. So the medical and mental health professionals, the caseworker, the nurse, the placement, guardian ad litem. We all work together as a team to try and decide what is best for this child, and if the child does need medications for assistance in certain behaviors. If a child is placed on a medication, he can only be placed by a mental health medication management provider, not your primary care provider. Foster parents should never discontinue giving a child their medication. It should only be discontinued by a medical provider. Very important. Please do not take it upon yourselves to decide whether the foster child does need their ADHD medication or their behavior medication because they're off school. Please do not do that. Make sure that only a medical provider can tell you when to stop giving that medication. The child's medications should always be stored in the original prescription bottle that is dispensed from the pharmacy. Please make sure if the child goes anywhere on a home visit, if they change placement, the medication needs to stay in that medication bottle so that we have all the appropriate information in that bottle. Non-prescription medications are paid by the foster parent out of your monthly funding. These are important licensing requirements for medications. Number 1, foster parents shall administer all prescribed medications according to the written directions of a licensed provider. Medicaid will only refill medications every 30 days. Please, this is extremely important. If for some reason you lose medications, you drop them on the floor, they go into the sink, and you ask for a refill, Medicaid will not refill these unless it's the 30-day time period. Okay, so we ask that you be very, very careful with these medications and do not discard them unnecessarily. Medications can only be given to the child that they are prescribed for. Over-the-counter medications may be administered according to the instructions or directions found in the box or the manufacturer's instructions. Medications shall not be administered from one child to another. There are older children that learn how to self-administer or give themselves their own medication, but they can only do this with the oversight of the foster parent and with written approval from their caseworker. Very important, all medications prescribed and over the counter must be kept in locked storage. Psychotropic Medication Oversight Review Panel. This is a panel that legislation mandated in 2016, and what this panel does at a state level is they oversee children that are on psychotropic medications. Now, if a child is 6 years of age or younger and is on at least one prescribed psychotropic medication or more, then the Psychotropic Medication Oversight Panel reviews this child's medication closely. If the child is 7 years of age or older and is on 2 or more prescribed psychotropic medications, then the Psychotropic Medication Oversight Panel reviews this as well. Kinship. Kinship placement is when a child in state custody is placed with family or close family, friends, members. All kinship placements will be assigned a specific kinship worker who will assist them throughout the process. Very important, if you are a kinship placement, if the child being placed in your home is related to you somehow through blood or is related to a close family friend, then you are considered kin. You will be assigned another caseworker that is a kinship placement worker, and that kinship worker will work directly with you, the family that the child is placed in, and help you through whatever resources are out in the community. They'll help you to be able to apply for the child's Medicaid, etc. Healthcare funding for children in foster care. Most children in foster care are eligible for Medicaid. Each child that is on Medicaid and is in state custody is assigned an ACO or an HMO, similar to the insurance HMOs. The foster parent must utilize the providers within that HMO. Please, if you do not know what HMO your foster child belongs to, contact your Fostering Healthy Children nurse immediately. She will be able to assist you and let you know exactly what HMO. If you have questions on what providers in your area are under that HMO, that is part of our job to help you with those resources. If you are not able to contact the nurse assigned to the child that is placed in your home, please contact the caseworker so that he or she may be able to communicate with the nurse. State funds are utilized until Medicaid is established or for undocumented children. If you have an undocumented child placed in your home, the state of Utah utilizes state funds to cover for all medical, dental, and mental health needs. MI 706 and 695P forms are used for temporary Medicaid coverage until Medicaid cards arrive in your home. These forms look like this. This is an MI 706. This is a 695P, and once you receive these, the nurse will work closely with you, call and explain what these forms look like. Now, this form here is very important. It will be included with the child when the child is placed in your home. When a child is placed in your home, the caseworker will be giving you an out-of-home book or an out-of-home binder. In there, there will be several papers that are very important. This is one of them. This paper states that the state of Utah is financially responsible for this child. So if you need to take the child to a hospital, to an urgent care, to the pediatrician, to the dentist, and they ask you to sign as financially responsible party in case Medicaid does not cover, do not do this. Give them a copy of this paper that explains exactly where they need to mail any medical bills that are not covered by Medicaid. So please, again, do not sign any forms that will put you financially responsible at any point for any of the medical bills for your child, whether it's an ambulance, a hospital, whatever the case may be. Do not sign anything that makes you financially responsible. Always carry a copy of this paper so that you may give them a copy, the provider, whether it's the ambulance, whether it's the hospital, so they know exactly who to bill if Medicaid refuses or denies a claim. Medicaid card. This is what a Medicaid card looks like. You should be receiving these in the mail usually 4 to 6 weeks after the child is placed in your home. Some of the HMOs like Molina, Select Health, Healthy U, depending on the HMOs, some of them have their own HMO identification cards, and this is an example of one for Molina. Medicaid expanded services. Children under the age of 19 are eligible for expanded services if they are medically necessary under the early periodic screening and developmental testing. Okay, so the states are required by federal law to provide any additional health care services that are covered under federal Medicaid program and medically necessary, regardless of whether the service is covered in a state Medicaid plan. So what does this mean? If there is a medical service or a medical necessity for that service that is covered under federal Medicaid, and the HMO that the child is under for state coverage, whether it's Molina, Healthy U, U of U Network, Select Health, whatever the HMO may be, if that state HMO does not cover, their Medicaid does not cover that medical need or medical service, and it is medically necessary, then by law, we, the state of Utah, need to cover that. If this is the case, you have that provider contact the registered nurse assigned to that child, and we will work with the provider to assure that the medically necessary service is covered. Now, what can the Fostering Healthy Children nurse do for the foster parent? Oh, we are awesome. We can become your best friend. We help locate and provide you with medical providers in your area. We help you with providers that are under the child's HMO. We try and help you identify the primary care physician that the child was seen prior to coming into state custody, because we do want you to keep taking the child when possible to the same primary care provider. This provides continuity of care. That provider already knows the history of the child, the history of mom, the family, the brothers and sisters, etc. So we do prefer that whenever necessary, you continue to take the child to the same primary care provider. Now, of course, sometimes this is not a possibility. If you live in Utah County and the child's provider was in Bountiful or in Salt Lake, this makes it a little difficult. And if this is the case, then as a nurse assigned to this child, we work closely with you in trying to help you locate a provider within the child's HMO in your area. We also help answer any general health related questions. We're here as a support system for you to provide you with community resources and try and educate you if you do have questions or concerns at any point. The nurse participates and provides input for the children at the child and family team meetings. We also provide health data reports for each child when a child is placed in your home. That is included in that packet that you will receive. With every child that is placed in your home, that will include the nurse's business card and contact information, the health visit report forms in the envelopes. We usually also include a copy of the child's immunization record and proof of Medicaid until that Medicaid card is mailed to you. And the Safe Health Data Report is just a history of all the medical information that we have for that child since that child was placed in state custody. What can the foster parent do for the nurse? Well, very important. Continue taking the child to their primary care provider when possible. This, like I said before, helps with continuity of care. That primary care provider already knows the child and the child's family history. Important to take the child's Medicaid card and the home-to-home book to the appointments with you. Make sure that you have a health visit report form completed at every medical, dental, and mental health visit, whether they are scheduled visits such as well child checks or unscheduled, whether it's an urgent care, whether the child is seen by the pediatrician for diarrhea, fever, vomiting, a bone fracture, whatever the case may be. We need documentation for every single visit. Make sure that the health visit report form is completed by the provider, that you tear that top portion page where the original where the provider actually wrote on, and put that in the mail for us in the self-addressed postage paid envelopes that we provide you with within 3 days of the visit. Now, we do understand that if a child is playing outside and jumping on the trampoline and all of a sudden you realize that they fell and broke a bone in their arm or their leg or whatever the case may be, and you're rushing them to the urgent care or the hospital, the last thing on your mind is to make sure that you have a health visit report form with you in the car. We do ask that you request a printout. Once you get to the hospital, to the urgent care, to the doctor's office, if you forget to have a health visit report form completed, we do ask that you request a printout from the provider for that visit. And because it is electronically signed by the provider, we are able to use that as our documentation. Also, we ask that when appropriate, biological parents are encouraged to attend these medical appointments. The caseworker will be the one working and contacting biological parents. It is important that you notify the nurse that is assigned to each child whenever the child has an emergency, whether the child is injured, hospitalized, etc. We ask that you contact us. Now, you do not need to call us ahead of time and ask for permission. You go ahead and take the child in. But we do ask that you contact us after the fact. If we are not in our office, if we do not answer, you can leave us a quick message so that we can return your call. But it's important for us to be aware if a child was hospitalized or if anything significant happened to that child, whether it was a fracture, whatever the case may be. If it was something significant, we need to be aware of that so that we can follow up with the providers, with you, with the hospitals, etc. The biological parent or caseworker must be the ones to sign consents for surgery, anesthesia, and non-routine procedures. You as foster parents cannot sign any consents for surgery, anesthesia, or non-routine procedures. Now, as foster parents, you do have the ability to consent for immunizations, prescription medications, things like that. It's important that you, as foster parents, complete and return the Ages and Stages questionnaire as soon as you receive it. We also ask that you administer all medications as prescribed. Do not take a child off medications except under the direction of the physician. Again, please, a reminder, do not take it upon yourself to decide whether the child needs their ADHD medication or their sleep medication. If it is prescribed to be given every day, we ask that you give it every day because that is how it was prescribed by the physician. Now, if at a certain point you, the child, the biological parents, the caseworker, the school, the teachers, the therapist, if someone is concerned and feels that the child no longer needs this medication, you do not stop that medication. You address it as a team at the Child and Family Team meeting, and then we bring that up to the medication management provider and have them make the final decision. Another important thing for the placement or foster parent is to make sure that you know what ACO or HMO your foster child has and what clinics or physicians do accept that HMO. Again, if you are unaware of what HMO the child that is placed in your home belongs to, feel free to contact the nurse and we are here to help you with that. Placement changes. Whenever a child is moved from your home, we ask that the following go with the child and be given to the caseworker. Number one, Medicaid card. Very important that you always have the Medicaid card, the HMO identification card if there is one, the medications in their original pharmacy bottles, list of future scheduled appointments so that the next placement is aware of their next dental, their next follow-up with urology, with pulmonology, etc. The home-to-home binder that includes the carbon copies of all the medical appointments or dental appointments that this child has been to, and WIC formula. If the child is on WIC and they have formula, please send that WIC formula with the child, as the next placement will not be able to immediately go to WIC and apply until they have their WIC letters. So if you have unused vouchers for WIC, those can be returned to the WIC clinic as those vouchers are under your name. Okay, well, this is the end. I know that there are a lot of questions probably coming up. There is a lot of information. What I can tell you is be aware that every child that is in state custody in the state of Utah is not only assigned a permanency worker, but a registered nurse. We are here as a resource for you. We are here to assist you with questions, concerns, anything that we can help. Give us a call. Make sure that you make contact with the nurse assigned to that child. If for some reason the nurse has not contacted you by phone, by mail, always ask the caseworker assigned to the child who the nurse is so that you may be able to make that contact. We are here as resources for you, for the biological parents. We are here for the child. Know that you are part of a team, and we are very, very grateful that you are taking time from your lives to take care of foster children. Thank you.